Coronavirus fears that are now hitting the United States. The CDC confirming a second U.S. case in Illinois. Reports possibly of a third case. We just don't know for sure. The agency is deploying a team right now, we know, to Chicago. Russia's tourism watchdog is advising halting sales of packages to China, and our own State Department had said proceed with caution if you're looking to go to that neck of the woods. Jonathan Seri is following it all as well as anyone I know in the...
And 35 million people under lockdown. In Wuhan, hospitals are overrun with people fearing symptoms of the pneumonia-like virus. China's military dispatching doctors with supplies to ease the strain on healthcare workers struggling to cope. At one hospital, patients isolated, with doctors using two-way radios to treat them at a distance. As officials race to build a 1,000-bed hospital for victims to be finished in just 10 days. The crisis deepening here and the virus now spreading, reaching Australia and Europe with confirmed cases in France and 9 other countries, including the U.S.
Again, officials now say more than 400 people have been sickened and 9 people have died. The World Health Organization is holding an emergency meeting right now. Kana Whitworth is in Seattle, has the latest for us. Good morning, Kana.
Hey, Robin, good morning. So that patient is a man in his 30s. He is in the hospital here behind me. Now, officials are describing his condition as satisfactory, but he will remain in isolation for at least the next couple of days. They will continue to monitor him as well as the healthcare providers and patients he came into contact with after testing positive for the coronavirus.
The first case of the deadly Chinese coronavirus making its way to the U.S. A Washington state man testing positive for the deadly virus. According to the CDC, the man in his 30s flew home to Seattle last Wednesday, infected but not yet symptomatic. According to officials, shortly after arriving in Seattle, he began feeling ill and reached out to his healthcare provider on Sunday. 24 hours later, his diagnosis was confirmed by the CDC. The man entering the country before federal health officials began screening travelers from the city of Wuhan, one of the busiest transportation hubs in central China, and where the outbreak began.
This is certainly not a moment for panic or high anxiety. It is a moment for vigilance.
This as some 3 billion trips are expected to be made by Chinese citizens heading home to celebrate the Lunar New Year Spring Festival. A reported 7 million Chinese tourists expected to travel abroad. Chinese officials taking every precaution to contain the virus. Workers outside of the local hospital in biosuits. Officials screening travelers as they enter and leave the airport. Our Bob Woodruff is here, walking through Wuhan Airport, wearing a 3-ply surgical mask to limit his exposure to the virus.
The city is now controlling people going in and out of the city. Then also local tourist groups are being banned from leaving. The government does not want this infection to leave.
Screenings now expanding to 5 U.S. airports, including Chicago and Atlanta. And anyone hoping to enter the U.S. from Wuhan must do so through one of those locations.
So right now the CDC is retracing this Washington man's steps. They say he actually did not visit that fish and meat market in Wuhan where they believe this virus originated. And also, Michael, they're really crediting this man for quickly alerting doctors once he became symptomatic.
All right, thank you so much, Kana. And now we're going to bring in Dr. Jennifer Ashton to answer a few questions that we may have. And Doc, there's so many questions about transmission of the virus. Right. We did human to human. Yesterday we talked about that. What more do we know at this point?
Well, again, what we know is that it's spreading. That's not really a surprise. What we don't know